Hello, my name is Austin Winters. Today I'm going to be talking about migrant farm workers' health and all of the issues that are faced and disparities along with healthcare for migrant farm workers. So who are they? Who are these migrant farm workers? Today, migrant farm workers consist of both men and women, mostly young, averaging 31 years of age or younger. Predominantly Mexican-born sons, husbands, or fathers. Majority of other migrant farm workers come from such countries as Jamaica, Haiti, Guatemala, Honduras, Puerto Rico, the Dominican Republic, and also other states in the United States. One report shows that 71% of farm workers speak Spanish as their first language. Along with 78% of these farm workers identifying as Latino or Hispanic. There is an estimated 4.5 million farm workers within the United States, and 1 to 1.2 million of those are migrants. The rates show that it's predominantly male, around 78%, with 22% being female. Also, 41% of migrant farm workers say that they have not visited a health center in the past 2 years. Lastly, 64% of migrant farm workers do not have access to health insurance. Moving forward. Some health concerns for migrant farm workers consist of accidents when using farming equipment, pesticide-related illnesses, which are often used on many crops all throughout the world. You also have musculoskeletal and soft tissue disorders, along with dermatitis. These farm workers can also face non-infectious respiratory conditions, which can be very serious, along with reproductive health issues if one farm worker may be pregnant or trying to have children. These children can also be born with issues that could relate to the pesticide-related illnesses and so on. There are climate-related illnesses due to working out in the elements. There are communicable diseases that these farm workers face. Many bladder and kidney disorders due to malnutrition and things like that, dehydration, being out in the heat and whatnot. These farm workers will also face eye and ear problems due to being out in the elements and being around all these pesticides and such. Another health concern would be anemia, along with diabetes. In this slide, we'll be talking about the lack of healthcare services. Many migrant farm workers struggle with zero access or lack of availability of health insurance. Also, migrant farm workers show low pay, which ultimately really limits them to healthcare services. Lack of knowledge is a very large barrier within healthcare coverage, because many migrant farm workers come to this country not knowing how healthcare works within the country. Many migrant farm workers travel alone for work, and they do not have family around or caregivers. If they were to become sick, they would have to act on their own behalf. Also, language and cultural barriers are also a very large issue, due to not speaking English or knowing how to express their pain or injuries or what they're going through currently. Also, with different cultures, there are different interpretations of health and illness. For us, a common cold isn't that big of a deal anymore, to where it could be in other cultures, along with other injuries and illnesses that we deal with. Also, there are uncertain immigration statuses, which these farm workers may not know what they are entitled to and what kind of healthcare services they could get. depending on their immigration status. So lack of healthcare services is a very big issue among migrant farm workers due to knowledge and just not knowing, no know-how. They've got to have some kind of guidance. There must be an intervention program providing guidance and the know-how. Gender within migrant farm workers is ever-changing, but still predominantly male workers. Gender plays a large role in health issues among the effects of being a pregnant farm worker. There are many issues a pregnant farm worker might face when working out in the fields. Migrant farm working women are now a large part of the labor force. Cultural norms do influence this, which allow more women to work or keep them from working in the farms, but the number of farm worker women is on the rise. Within migrant farm working, there are many gender differences. For example, men take on the more strenuous work such as machine operating. They're also in charge of using any equipment, and they tend to have higher pay due to these gender norms for certain tasks. With that being said, it's considered what women do in this field simple work, such as hand picking, irrigation work, and stuff like that. With that being said, they also get less hours along with less pay due to these tasks being considered simple. Although there is one benefit to that, and that is the lower risk of injury to using less equipment and machine operating, which will make them do less risky tasks. The men might have a higher pay, but they also have a higher risk of injury, which will ultimately affect the health on gender here. The Helping Hands intervention will provide a multitude of services offering full checkups and preventative medicine for migrant farm workers. This is a community-level approach to raise awareness on how important healthcare and preventative medicine really is. It will be at a high cost, but being on a community level, getting help that day can make all of our migrant farm workers tomorrow's better. Here are a few ideas listed below. These are just a few things that will be included that can and will make a huge impact with the migrant farm worker community. We will spread the word months and weeks in advance to assure a large gathering. Throughout the Helping Hands intervention, our target population is going to be migrant farm workers of all backgrounds, men, women, and their children. Gender is represented by having healthcare opportunities for male and female workers with an intention of helping everyone. This intervention is relevant by spreading knowledge on how to obtain healthcare and about healthcare in general, along with providing checkups and different types of clinics. Within migrant farm working, women are now a large part of the labor force. Cultural norms do influence this, however, the number of migrant farm worker women is on the rise. Gender within migrant farm workers is changing, but it's still predominantly male workers. And with that in mind, gender plays a large role in the health issue due to effects of being a pregnant farm worker. Gender within this intervention will be a little more in depth for women, offering different types of health care, screenings for pregnancy, along with such things like mammograms or a gynecologist needs. This intervention will provide full checkups and offer a multitude of services, so that way everyone is covered and everyone can be checked out. The ultimate goal of this intervention is to raise awareness and show these migrant farm workers that we do appreciate them and what they do does matter. In conclusion, here are my references that I used from the UNCG library. This is definitely a rough draft and I have a lot of work to do, but I appreciate you guys viewing. Thanks.